Assalamu alaikum. Our lecture is about the vitamins. As we all know that the nutrient generally can be divided into two types, macronutrient and micronutrient. And the macronutrients include the protein, carbohydrate, and lipids, which is important for the metabolism or production of the energy. And we have micronutrients, which include trace element and vitamins. So the vitamins are part of the micronutrient. We can define the vitamin that are organic substances with the key rules in certain metabolic pathway, especially for production of the energy, and they are required in a small amount in the food. And according to the body store, which is varied according to the vitamins, and some of the vitamin need years to deplete the store depending on how much amount is stored in the body, like the vitamin B12 and vitamin A needing long duration time to deplete the store, while the folate and thiamine need weeks to deplete before the development of a clinical manifestation after the interruption of the supply or oral supply of the vitamin. So the clinical manifestation lag behind the interruption of the supply either by years, like in the vitamin B12 and vitamin A, or weeks, like the folate and thiamine, depending on how much amount stored in the body. Generally, we can classify the vitamin according to the water solubility, either to the fat soluble vitamin like vitamin A, D, E, and K, and water soluble vitamin. And the water soluble vitamin include the combination of B complex vitamin and vitamin C. That is to start with the vitamin B1, which is called thiamine. And the active form of the thiamine is called the thiamine pyrophosphate, and it is essential cofactor in carbohydrate metabolism for production of energy, because it is involved in the oxidative decarboxylation of acetyl-CoA in the mitochondria, and also important for Krebs cycle or in the Krebs cycle as a key enzyme for decarboxylation of alpha keto acid for production of energy. Also, the thiamine has a role in peripheral nerve conduction, but by unknown mechanism. The main source of the vitamin is a plant source, like in the cereals and the legumes, but it's also a presence in the animal source, like the pork meat, in addition to the beef meat. And what happens after deficiency of the vitamin or interruption of the supply of the vitamin, cell cannot metabolize the glucose aerobically, and this is most probably will affect the CNS system or the brain initially, because the brain cell is depend on directly on the glucose or the glucose in the blood for production of the energy. They don't have other anaerobic way of production of energy. So there is an accumulation because of the interruption of the aerobic metabolism for a production of energy. There is an anaerobic metabolism, and this is cause accumulation of pyruvic and lactic acid from this metabolism, and these two products produce vasodilatation and increase the cardiac output by increasing pumping of the heart, and if this condition is continued, cause heart failure. In addition, the patient with a chronic illness like the patient with the cancer, it also need excessive thiamine because the patient has a state of hypermetabolic state due to rapid turnover of the cells, tumor cells, so it needs thiamine for the metabolism of these cells. So there is excess need of the thiamine, therefore the patient may have a deficiency state of thiamine or B1. As we all know that the nutrient generally can be divided into two types, macronutrient and micronutrient. And the macronutrients include the protein, carbohydrate, and lipids, which is important for the metabolism or production of the energy. And we have micronutrients, which include trace element and vitamins. So the vitamins are part of the micronutrient. We can define the vitamin that are organic substances with the key rules in certain metabolic pathway, especially for production of the energy, and they are required in a small amount in the food. And according to the body store, which is varied according to the vitamins, and some of the vitamin need years to deplete the store depending on how much amount is stored in the body, like the vitamin B12 and vitamin A being long. For the dry periphery, usually patient presented with a feature or a symptom of peripheral neuropathy like sensory pain and paresthesia due to sensory neuropathy, and usually started in the lower limb and can ascend up in the upper limb. And in severe form, patient may develop motor manifestation causing paraplegia. And also, or in addition, cerebral manifestation, patient have two forms of CNS manifestation or cerebral manifestation in addition to the peripheral neuropathy. We have what's called Wernicke encephalopathy, and the patient usually presented with the acute state of mental impairment like confusion associated with the cerebellar ataxia and ophthalmoplegia or weakness of the extraocular muscle of the eye causing squint. So this is an acute illness called Wernicke encephalopathy, and we have a chronic form of the vitamin or thiamine deficiency cause neurological manifestation called Korsakoff syndrome, and this is usually presented with the loss of the new memory, but the past memory is intact and the new memory is impaired, associated with the confabulation. And the confabulation is the patient start to confabulate an incorrect event or an event that did not happen in the past. So this is called confabulation, in addition to the loss of the new memory or the preservation of the past memory. And the patient who have wet periphery, as I mentioned before, it's usually predominantly presented with the cardiac manifestation, and due to effect of the metabolites of anaerobic metabolism, the patient will develop increased cardiac output and peripheral vasodilatation, and if it is not corrected for a prolonged time, they will make a burden on the cardiac function, causing what is called high output cardiac failure, like the patient with the thyrotoxicosis. So the diagnosis of the thiamine deficiency is by measurement of the circulating thiamine in the blood, and once the diagnosis is established, depending on clinical manifestation and the measurement of the serum thiamine, the treatment should be started, and usually started at the parenteral injection, 100 milligram per day for 7 days, then switch to the oral until complete recovery of cardiovascular and ophthalmic and neurological manifestation. Usually the cardiac and ophthalmic manifestation improve rapidly, but the other take long time, probably days or weeks. The second water-soluble vitamin is called riboflavin, or B2, or vitamin B2. Riboflavin is a flavoprotein that is a cofactor for, again, many oxidative reactions in the cell for production of the energy. The main source, riboflavin, is widely distributed in all food sources, including plant and animal, but the main source is dairy product like the milk, and also the cereals and the legumes is the good source of the vitamin B2. The deficiency causes usually dietary with the other vitamins. So the isolated riboflavin deficiency not existing in clinical practice. Usually the deficiency with the other vitamin because it's present in all the food source. And the clinical manifestation usually starts in mucocutaneous lesion, which is a common manifestation. All the vitamin B deficiencies usually started with the angular stomatitis, which is inflammation of the mucosa, especially at the angle of the mouth, causing the crackles at the angle of the mouth, in addition to the inflammation of the tongue or glossitis. Seborrheic dermatitis usually occur in the face, around the nose, and the diagnosis usually settled by calculation of the level of the riboflavin in the serum of or the urine. Treatment usually replacement with a 10 milligram daily till the complete recovery of the clinical manifestations. The niacin, which is the B3, niacin existing in two chemical forms in the body, nicotinic acid and nicotinamide, and the main function of niacin in the production of the energy in addition to the DNA repair. And the main source of the niacin is the plant source, like the cereals, but in addition it's present in the meat also. Another important function of the niacin, or the metabolism of the niacin can be synthesized in de novo, or in the human body, or from the tryptophan, which is present in the dairy product like the milk and the eggs. So the tryptophan could be the source of the production of the niacin in the body. The main cause of the isolated niacin deficiency usually occur in the people who ingest the corn-based diet without taking the other type of the diet, like in some part of the Africa and Asia, or China especially, what is called corn-based diet, they can develop isolated niacin deficiency. Or could be deficiency with other vitamin deficiency or other B-complex vitamin deficiency, like in patients with GIT cause state of malabsorption. Again, in alcoholic dependent patient, alcoholism or alcoholic patient, chronic alcoholic patient, they have a little niacin in the body. There is also a patient with a carcinoid syndrome. They have deficient vitamin B3 or niacin deficiency. This is because of the patient who have carcinoid syndrome, which is one of the neuroendocrine tumor. They secrete serotonin, and serotonin, it needs tryptophan for its production, so there is a diversion of the tryptophan for the serotonin production, and it diverting from production of the niacin from the tryptophan. So any patient with the neuroendocrine tumor, especially the carcinoma, they have deficient niacin, and they may develop clinical manifestation of the niacin deficiency. The clinical feature or manifestation of niacin deficiency in form of what's called pellagra or syndrome of pellagra, which is a combination of 3D, dermatitis, diarrhea, and dementia. And in the beginning, usual patients have non-specific symptoms like anorexia and general weakness or fatigue. Then they develop glossitis and angular stomatitis like in the other vitamin, and then they develop a specific manifestation will start as dermatitis, and the typical form of dermatitis is usually around the neck or around the base of the neck, and they call it what is called Kazan necklace, an exposed area to the sunlight, and the patient presented with the scaling pigmented skin rash at the base of the neck. And also patient may develop diarrhea, and the cause of diarrhea is usually non-infective diarrhea because of the proctitis or mucosal changes in the rectum causing frequent bowel motion. And if the deficiency state is severe and not corrected, patient may develop decreased intellectual function causing dementia. Diagnosed usually by assessment of the byproduct of the niacin, which is urinary 2-pyridine and methyl or 2-methyl nicotinamide. Treatment usually replacement orally till the improvement of the clinical manifestation. We have also the vitamin B6, and it is existing as pyridoxine, pyridoxal, and pyridoxamine in a 3-component, and the main functions involved in the metabolism of amino acid, including in neurotransmitter synthesis. And as in addition, the vitamin metabolism or the vitamin is important for metabolism or production of the niacin from tryptophan. So the niacin production is need the vitamin B6 for production from the tryptophan or amino acid tryptophan. The main source of the B6 is widely distributed in the plant and the animal foodstuffs, so isolated deficiency is rare. So the main deficiency is due to presence of the using of drugs like INH, hydralazine, and penicillamine that decrease the absorption of the B12 and antagonize the activation of the B6 in the body. The main clinical manifestation mucosal changes, which is the common shared in the other vitamin, and peripheral neuropathy. And the main treatment is the replacement of the vitamin 100 mg daily, tab should not be exceeded till the recovery of the all clinical manifestation. And vitamin B12, the main function or the growth factor for activation of the folate or demethylation of the folate from methyl tetrahydrofolate to the polyglutamate tetrahydrofolate polyglutamate to the tetrahydrofolate, which is the most active form of the folate. The main source of the vitamin B12 is animal, is not existing in a plant, like in the meat, fish, eggs, milk, and so on. So the patient who is strictly vegetarian, they are liable to the development of the vitamin B12 deficiency. As we mentioned in the beginning of the lecture, the storage may take years before the development or the depletion of the storage before the development of the clinical manifestation. The main cause of vitamin B12 deficiency is, as I mentioned, in the low dietary intake, like patient who is vegetarian or strictly vegetarian, and in addition to the patient with a stomach problem, because the absorption of the vitamin B12 is depending on the presence of factor in the stomach, or what's called intrinsic factor, that combine the vitamin B12 and get it to the ileum where the absorption of the B12 there. So the pernicious anemia in patient with what's called autoimmune gastritis or proximal gastritis, the destruction of the parietal cell in the proximal stomach causes the decreased production of the intrinsic factor, which is important for the vitamin B12 absorption. In addition, gastrectomy, like patient with sleep, and congenital deficiency of intrinsic factor, which is extremely rare condition, and in any small bowel disease, especially the ileal disease, like ileal TB or ileal Crohn's, resection of the ileum, patient can develop vitamin B12. Bacterial overgrowth with state of excess production of the or excess presence of the bacterial normal commensal or normal bacterial commensal in the small bowel, like the patient have fistula connecting the colon to the small bowel. So there will be excess bacterial growth in the small intestine, cause the conception of the B12, causing the B12 deficiency. And in other causes of the infestation, like Typhlobothrium latum infestation, that can consume B12 in the small intestine. The main clinical manifestation is megaloblastic anemia or macrocytic megaloblastic anemia, and in addition to the mucosal changes or glossitis and angular stomatitis, and the neurological manifestation. And the main neurological manifestation, especially at the beginning, are the neuropathy, and if the clinical deficiency state is severe and continue, which is not corrected, then the patient may develop a state of subacute combined degeneration of spinal cord, and usually started in the posterior column degeneration, and also may involve the lateral column of the spinal cord. Psychiatric problem also, the patient may develop depression, may develop dementia and optic atrophy. And in neuropathy, usually symmetrical, started as paresthesia in the finger and the toes, and they may develop motor neuropathy causing paraplegia also. Subacute combined degeneration of spinal cord usually start in the posterior column, which is the corticospinal tract responsible for the vibration sense and proprioception, or the position sense in the body, and degeneration of this column causing the loss of the vibration sense and proprioception, causing sensory ataxia. And in severe deficiency state or in severe manifestation, patient may develop also degeneration of the lateral column of the spinal cord or the spinothalamic tract, or corticospinal tract, that is responsible for the motor function of the body. So the patient may develop progressive weakness, especially on the lower limb. So finally, they may end with the paraplegia. Assalamu alaikum. Our lecture is about the vitamins. The folate, and this is one of the water-soluble vitamin and present in the food in reduced dihydrofolate or tetrahydrofolate. And the main function of the folate is in amino acid metabolism and DNA synthesis. Main source of the folate is the plant source, like in green vegetables. It's also rich in the liver. And the main cause of the folate deficiency were nutritional causes, like poor intake, like the patient, an elderly who did not take much vegetables, and in poor social condition, and patient with prolonged anorexia, and also in gastrointestinal disease, like small bowel disease, like a patient malabsorption state, as in patient with celiac disease, and in addition to the anti-folate drug, like the patient anticonvulsant, phenytoin, barbiturate, or the patient have methotrexate, trimethoprim, and sulfasalazine that antagonize the absorption and the activation of the folate in the body. In addition to the patient who have a good amount of the folate in the body and the food in the body, but have excess use of folate, so excess utilization of the folate, like patient need more folate in pregnancy for production of the or growth of the fetus, need folate because of this necessary for metabolism of the DNA and the cell, and also in lactation, and also in patients who have excess folate need, like in patients with hematological disease with excessive red cell production, like in chronic hemolysis, need their folate replacement because they need folate for the production of a red blood cell. In addition to the malignant cell will increase cell turnover of the tumor cells, so it need excess folate of production of the DNA and cell. In addition to the chronic inflammatory condition like rheumatoid arthritis and SLE and so on. And in neuropathy, usually symmetrical, started as paresthesia in the finger and the toes, and they may develop motor neuropathy causing paraplegia also. Subacute combined degeneration of spinal cord usually start in the posterior column, which is the corticospinal tract responsible for the and replacement of the folate is the main modality of treatment. Usually we need 5 mg folate daily for at least 4 months to replace the body folate. Treatment of the underlying condition like the malabsorption. Sometimes we need prophylactic folate acid like 1 mg daily is recommended for all women planned for pregnancy at the beginning of pregnancy, because there is evidence that replacement of the folate in the pregnancy since the start decrease the evidence or decrease the incidence of a neuronal tube defect in the fetus. And in addition to the chronic hematological disorder like chronic hemolytic anemia. Finally, the vitamin C, which is one of the water-soluble vitamin, and as we know it's important or it's involved for hydroxylation proline to hydroxyproline, which is necessary for collagen formation. And the main source of the vitamin C is fresh fruit and vegetables. So its deficiency mainly present in the elderly who cannot take the fruits and vegetables because nobody care behind him and shopping for him the fruits. And also increase the need in patients who have multiple trauma and severe burn. And in the drug antagonize the action of the folate, like patients with indomethacin, use of indomethacin, aspirin, tetracycline. And the clinical syndrome caused by the vitamin C deficiency is called scurvy, and usually started as hemorrhage because loss of the supporting soft tissue supporting the blood vessels. So the clinical manifestation predominant is a bleeding, and usually start in the skin in the loose area like the perifollicular area, and sometimes presented with a sponge swollen gum with easy touch bleeding and probably superadded infection. And if the deficiencies is not corrected, the patient may develop deep bleeding like in the GIT or the joint, sometimes in the peritoneum. In addition to the bleeding, patient have failure of proper wound healing. And the diagnosis is usually depending on clinical manifestation and the history of interruption supply of the food, and in addition to assessment of the vitamin C level in the blood, which is usually low. Treatment usually replacement orally, and in addition to encourage the patient to take the source of the vitamin C in the food, like fresh food and vegetable. And thank you very much.